This is 43-year-old me, or we call him the mayor in the office. He has knee pain, and he's coming to me. We're going to treat his neck, yes, to get his knees better. And you're going to see that today in the first treatment. We're also going to treat his hand numbness, his grip strength, his sleep, his shoulder pain, and feet, all from a neck adjustment. Here's his range of motion. Here's his knee pain. Here's me talking about creaking his knees. And here's his grip strength. His x-rays suck. Giddy up.
I do like this adjustment, though. It's a game changer.
That was good.
That was really good.
So my name is Mayur. Just turned 43. I'm a marketing analyst. About 3 years ago, I started noticing knee in my pain to the point where I couldn't bend it completely.
Pain in his knee.
It started on one knee,
Gotcha.
and then actually moved to both knees. But I saw no swelling, and so I wasn't sure what that was. So I was taking a lot of ibuprofen to
just to get through the day.
I was already going to acupuncture for my carpal tunnel and trigger finger. And then they noticed like, hey, you look like you're walking kind of funny. And I said, yeah, I started getting this pain. I don't know, like what's causing it. And so from then I was getting adjusted.
Chiropractic after that or at the same time?
At the same time. I felt some improvement, but obviously it's still
I think
there.
you had low back pain or something. That went away.
Yeah, yeah.
But the knees never got any better and the carpal tunnel never got any better.
No, I mean, the purple's gone. It's just more the fingers now, the trigger finger.
Whatever, he has no grip.
It's pretty
he has
much.
no grip strength.
Yeah, no grip.
So just a couple weeks ago, he was still going to a chiropractor.
Correct.
And he found me on Thumbtack.
Thumbtack, yeah, exactly.
That's funny.
Yeah.
My first patient on Thumbtack. I think that's hilarious. I thought I was giving up on that thing. I almost took all my ads down because I hadn't heard it from anybody. The interesting thing, he's behind the computer all the time, but he likes to run. He likes to exercise. And he's a little depressed because he can't do the things he enjoys, which is running and which is doing things. So I am happy he's here because we're going to make him better and we're going to do it an unconventional way. We ain't going to frickin' touch his knees and he's going to get better. He's like, he's laughing, but he sort of believes it too. That's why he's here. Rear-ended in 2008, snowboarding accidents, lots of played basketball. So the guy's athletic, even though he doesn't look it, he's athletic. I had similar injuries from golf, and I totally sympathize with him because I understand how sucks to not be able to do the things you want to do.
Mm.
See how he turns? He has to turn his whole body. He doesn't turn his neck. His neck is all stiff like this. And so you can see it right here on the camera that he has problems with his neck.
That's the furthest I can go left.
Yeah. So you guys can see it, right? The x-rays are pretty interesting because they're not really that screwed up. His reverse curve is definitely there. Some arthritis. His back's arthritis. He has a short leg. You're looking for the old smoking gun. And really, I think it's his occiput.
Mayor's x-rays show 5mm imbalance, occiput tilt, and right TMJ. Here we have a 6mm right short leg rib calcification. Here we have 1/3 atlas wear, low reverse curve, and mild arthritis, sway back, and mild arthritis in the low back.
What kind of pain in your back there, sir? How much on a scale of 1 to 10?
About 2.
You said that was a little bit more.
Yeah,
maybe?
that's about 3 or 4.
Good. How much pain in your neck there? Not really
1.
anything. How about that?
Yeah, it's about 0.
Turn your side. Look at guys. Look how much he can look up. He can't look up at all. Now we're going to check his knees. And I guys want, listen in. You can hear his knees crickle. So go ahead and spread your feet just a tiny bit right there. Now squat. How's that? Oh, man.
That's a 9.
Did you guys hear it? It goes, squeeze as hard as you can. Okay, look at this. Now squeeze. Look at this. Squeeze as hard as you can. Nothing. Nothing. Squeeze as hard as you can. Both hands are so freaking weak. This was a little bit weaker, but he's right-handed, but really, really, really weak. You ready for a miracle?
Yeah.
He's so cocky. How nervous are you, sir?
About 8.
Gotcha, about 8. Good. I'm having trouble rotating him. I may change the adjustment in the future, but we're going to go for this standard one right here. Okay. Let me have this. Painful at all?
A little, just on the vibrating part, but like the actual turn, no.
Yeah, no, I was surprised. It went pretty easily.
Yeah.
I was expecting way harder.
I've gone to this chiropractor and we have never gotten that.
Even
like
close.
You got all the way. Like I never felt it go all the way. So I always felt like I got like a 1 or 2 click. You got like all of it.
Yeah,
so
cool. My method, guys, is I'm trying to change the frame. Yeah. I'm not just trying to get a couple of clicks out of your body. I'm trying to change the way your spine is shaped. And so you can see how much force I put in there. And it's not just to get a lot of cracks. I don't really give a shit about the cracks. It's about pushing, holding, changing, stretching, putting the body in a different position. That's what I think you felt too. The best part about it wasn't as painful as I thought it was going to be. Okay, right in there. No screaming in pain. Come on, AJ, let's hear it. We had this vision, both of us, that he was going to be like that one patient from Maryland that we saw because his neck is so stiff. But you took that like a champ.
We like to help our patients up after their first adjustment. Sometimes they're a little lightheaded, sometimes a little disoriented. You can see Mayor's a little bit here. We're also reminding him not to twist and turn or he will undo my work. So let's check in and see how he's doing.
I feel a little lightheaded in the sense of like a...
We're going to adjust Mayor here, like we did with AJ. His neck doesn't rotate very much. I am adjusting from the back, and I'm doing a pretty good job in a normal way, but it's still hard to rotate him, so I thought I'd try this one. And so he's the only second patient I've ever done this on. He's excited because he's seen AJ's video, and we'll let you guys watch. The real purpose of this is to create a proper curve in the neck. I can't wait to see how this works. Okay, let's go. Woo! Kind of interesting adjustment, huh?
Yeah, it was interesting. Get from the past ones.
Exactly from the back, huh?
Yeah.
Yeah. How is that different than the ones when I do it when I have you laying down?
Definitely didn't feel the headache, like the little ringing. But the crunch is still the same.
Yeah. What I love about it is that again, it's directly working on his curve of his neck, and so I can't wait to see how he does.
I didn't feel the muscle as tight as yesterday.
It was definitely much easier for me.
Yeah. Because yesterday I know that it felt really tight. I was like, oh, geez, that's not good.
Yeah. Good. Yeah, this one, good right there.
Wow. Yeah. I almost like slid off.
I know. Wow. That was pretty intense. Get up off the chair, please. Good. And so that's actually still better than it was. Put your feet closer together. Now try to get up like that.
Yeah, that's the hard part.
I know. I got it.
Oh, no.
I got it. Just. Whoa! That was way faster than I thought it was going to be. How'd that feel? Was that painful?
No, it wasn't painful.
So why don't you do that more often?
Now that I learned the relax method, I will start doing that more often. I feel like I'm doing really great. Definitely, I've seen the most improvement I have in a very, very, very long time.
Good.
As long as you keep with the program and do what the doc says, you'll be fine.
Best answer this year. What did you learn last night about the posture stuff I taught you? I loved how you said that. You said about you changed your balance. And tell me a little bit more about that.
Yeah, I started, with the new posture, and I started getting like a rocking groove. And with that, changing my center of gravity, basically.
And you felt that?
I felt that,
yeah.
And it made everything felt more, the most normal I felt in a very long time in terms of walking and feeling not robotic and stiff, which I've been doing for the last...
And all he did was change his posture, just the lower part of the neck, so that when he does his posture, he can relax his shoulders a little bit more. I'm going to push in your shoulders. This is going to hurt like a son of a gun here. Most important thing is to breathe in your nose, out your mouth.
Ooh, right there.
So
that's
now,
a 7.
That's a 7. Yeah. See, it's only a 7 in his face. Look at his face. Does that look like a 7, guys? I'm going to let go in a second. You can tell the camera what you feel after I let go. Good.
Oh my God. I feel like 1,000 pounds just like lifted off me.
How does the brain feel after that?
Ooh, clear.
We're just in his lower neck, guys. Let your head just fall this way. He's really tight. I have no idea how much we're going to adjust him. Okay, good. And now you're going to turn your head to the left, please. Oh, wow. That even surprised me. You okay?
Yeah, I just got to calm myself.
Calm down. Yeah, I can feel it, yeah. Now I want you to bring your head forward like a turtle. More like a turtle. Excellent. Holy moly, huh?
Basically the best I felt about 4 or 5 years, honestly. Definitely what he does. And if you follow the homework, you definitely learn to kind of enjoy your old body again. And that's the best way of saying it.
The way I'm teaching him to walk, that he's having the same kind of euphoric, relaxing feeling.
Yeah.
And he's forgot how important that is and how good it feels.
Yeah, definitely.
Yeah, awesome.
Definitely the patience. Because
patience for you?
For me. Okay. Because once you do your adjustment, you definitely feel this pain lifted. And like I said, you want to go 100, right? And it's just because I've been you've been restricted for so long that now it's like this power is kind of like back to you. But then, depending on how long you had your issue, like it's not that quite simple. So It's just learning to be
patience is a virtue.
Yeah, yes. And so just learning to kind of like
Talks about the other chiropractor we used to go to that used to come away and the improvement would last how long?
A couple hours at best, maybe that night.
Yeah. And so you leave the office going, I feel better, thank you, Doc.
Yeah.
And then, so how is this compared to that?
Oh, it lasts days. Like
exactly.
I literally, it has not been a time where, literally after even the first day, like where it didn't come back to the levels prior.
Yeah.
It was always like less and less. And so it definitely...
You came in for knee pain, right? Knee pain was your primary. Why are you laughing?
Because I know what you're going to say.
Right knee, how much better is that?
Oh, it's pretty much gone.
Yeah. The hand numbness?
A lot of it's gone. There's still some there, but definitely I can almost make a fist.
The weak grip.
Yeah, much better. I can actually open jars easier than before.
And sleep?
Sleep definitely much better.
So the funny thing is he also has shoulder problems, which I didn't even know about.
And then the plantar fasciitis.
And the plantar fasciitis too.
Probably all day.
It's not even written on here because he didn't even talk about it.
Yeah.
And so how much better are your shoulders?
Oh, a whole lot better.
And we didn't even know they were a problem at first.
Yeah.
And then how much your feet?
Feet's really good too.
And you even suffered that your whole life almost.
Yeah. It's definitely...
it was so consistent that he didn't even mention it in his history.
Yeah.
Didn't even mention it that he had plantar fasciitis.
Yeah, because the knee felt so much... Or I focused on the pain on the knee so much that I completely ignored my foot.
Yeah, interesting.
You only touched my neck.
Only the neck, guys. Only just the neck.
Only the neck.
Right?
Amazing.
Only the neck. And so when you guys always go, it's not the neck. Neck does nothing. You're full of shit, Dr. Thayer.
Yeah. Yeah, I've gotten adjusted.
Only
I got adjusted throughout the back, the hip, all that.
Toes, ankles, knees. You said the other guy used to pull on your knee, adjust your knee?
Yeah, pull my leg to adjust, and I would, on the side, and then that. Like that, again, like I said, it lasted an hour or two, except at the night, the next morning.
Have I massaged your leg at all? Have I adjusted anything below your neck?
It's literally just the neck.
Just neck.
And everything just falls into place.
I know it's hard for your chiropractors to believe that, but you should. And the reason you should is you don't have to get away from your type of treatment, but you should understand the neck is really freaking important and get a good neck adjustment, and you could do all the other bullshit thing you do, but you'll get your patients better.
Yeah.
Anyways, let's get you adjusted. This adjustment focuses on just that curve I was telling you about. Drop your head again. Drop. Drop. Just let your head fall. Good. Come back towards me. Good. Nice. Oh, boy. I do like this adjustment, though. Really. It's a game changer. Come this way, please.
That's good.
That was really good.
Because I was loose.